the radiology package, which includes, among others, MRI, CT scan, ultrasound. We are talking of emergency evacuation services, overseas treatment, among others.
Powerful, very well detailed information there, Osoro.
Thank you,
And
sir.
for many Kenyans, they are wondering, is NHIF still important? And the question that I would like to pose to you: do you believe still that NHIF is important? Something that you have? Are you insured in the NHIF? You can be part of this conversation. The SMS line is on at the top of your screen, 20154. Start with the word Channel 1. Tell us your name and where you're watching us from. On Twitter, at the bottom of your screen, the hashtag is Good Morning Kenya on Twitter, at KBC Television. Tag me at Ram Aguko, my colleagues handle at Jane Wamboy, at Ray Manyara, and at Doreen Arange. So, that is what I'd like you to tell us, Osoro. Do you think that NHIF is still important? Do Kenyans really understand the importance of the NHIF?
Let me start by saying that a healthy nation is a wealthy nation. And as you said when we started the show, afya yetu, bima yetu. Healthcare is very important because without having a healthy workforce, no nation can advance. The most important thing one can do is to invest in a reliable insurance health cover for you and your family.
So, and if we talk about for you and your family, is there any age limit when it comes to registering for NHIF?
At NHIF, unlike other commercial insurance agencies, we do not have an age limit for one to be a member. The requirement is pursuant to Section 15 of the NHIF Act number 9 of 1998. It states that anyone who has attained the age of 18 years of age and whose total income is such as prescribed by the board in consultation with the minister, and we are talking of anyone earning above 1,000 shillings, shall be a member of NHIF. Yes, and there is no age limit.
There is no age limit.
That is the lower age limit. For the upper age limit, you can join at any particular time.
And since NHIF was established in the year 1966 till now, there have been so many changes that have been, going on in NHIF in terms of payments. And so far, back then, payment was different from how it is now. So right now, how can someone make payments towards the NHIF?
Thank you, Ram. For those in the formal sector, payments range from Kenya shillings 160 shillings up to 1,700 shillings. These are the revised rates that came into effect in 2015 when the act was revised.
It was revised 2015.
Yeah, and the minister gazetted new rates that came into effect in 2015 April. For those in the informal sector, popularly known as self-employed, we are talking of border riders, farmers, mechanics, retirees, and other persons back at home like farmers. They contribute a monthly premium of Kenya shillings, 500 shillings per month. The 500 shillings enables them to access the entire length and breadth of the benefit package, and we are talking of 13 benefit packages that I mentioned earlier on.
So we're talking about now anyone can be able to make payments because it's now affordable.
It is very affordable, accessible, and sustainable.
Regardless of your class of work.
It doesn't matter. At NHIF, all Kenyans are equal in the face of NHIF. We do not discriminate.
But you'll find that for some Kenyans, they fail to pay this monthly premiums, yeah, and it becomes a bother to them that they are not able to pay them, and it accrues in due time. And how can you be able to cater for that kind of a need? Because, for example, someone has not paid for NHIF for over a year. How do they come back?
Thank you, Ram. As you've aptly asked, is that there are Kenyans indeed who are not able to pay the 500 shillings or 18 shillings per day, which are premiums to NHIF. But the good news is the government has put into place mechanisms to cater for such cadre of people. We are talking of the poor of the poor, people with severe disabilities, and orphans. We have a program that is run in conjunction with the government, which is known as the Health Insurance Subsidy Program, whereby this kind of people can be identified through the ministry of gender and the youth, and they can be catered for comprehensively. On the issue of making remittances, NHIF has provided a platform through which it's convenient to a membership to remit funds to NHIF. One, they can go to any banks, and when we are talking of banks, we are talking of KCB, Cooperative, National Bank, Equity, and others, whereby they can be able to remit their monthly contributions. We have also provided for remittances on the digital platform through M-Pesa, whereby you go to M-Pesa, pay bill, it will promptly ask you for the pay bill number. For this matter, it is 200 222. It will ask you for the account number, and in this case, the account number is your national identity card number.
This is when you go to M-Pesa. You say the first instance only you put 200
222. That is the business number for NHIF. It will ask you for the account number. For self-employed persons, the business number is the account number is your national ID number. Then you will put in the monthly premiums, and we are talking of, if it's a month, it's 500, 2 months is 1,000, 3 is 1,500. And at NHIF, we accept prepayments. You can pay for the entire year.
And
thirdly,
yes,
you can also make payments through your e-wallet. You go to your e-wallet, top up the amount, and make payments directly from your e-wallet.
And you've talked about the payments, but after 1 full year, do they also need to register fresh after being off for more than a year? What happens?
Thank you. That's a very good question. For those who have been unable to make remittances, that is defaulters. If you have defaulted making remittances to NHIF for within a period of 12 months, that is 1 year and above, if you want to rejoin, you will pay 3 month subscriptions, which is equivalent to 1,500, but it will take 2 months or 60 days, whichever comes first, for the card to mature, what I refer to as a gestation period. For those who have not defaulted for more than 12 months, the good news is that they can pay the outstanding standard contributions and an accruing penalty, subject to Section 18 of the NHIF Act number 9 of 1998. If a member does not remit premiums in the time and manner prescribed by this Act, and the time and manner prescribed by this Act is that premiums should be paid on or before the 9th of the following month. For example, we are talking of October. Payments for October are due to be paid to NHIF on or before the 9th of November 2018. If you pay on the 10th, then for a member of the informal sector that is self-employed, it will attract a penalty equivalent to 50% of the standard contributions, which is 250 shillings.
Per day?
Per month.
Per month.
So for each month you default paying, that is for people who have not remitted contributions, for a period not more than 12 months, it will attract a penalty of 50% or 250 shillings.
Okay. So it means the longer you take, the more the penalties accrue, because it now comes per month, 50%.
Correct.
And looking at NHIF, so for the viewers at home, so it means that make sure that you really get to pay your NHIF on time before the 9th of every month. Correct. For you to be able to get proper services.
Yes.
All right. And just looking at still on the issue of family, if someone has children, do they have the ability to add, because how population is, the population normally grows. Can you add a child to the cover in case someone has one, and what is the procedure?
NHIF is the NHIF Supa cover is a family-based cover. It recognizes both the declared spouse, and I underline the word declared, and declared dependents, that is children arising from the marriage, or any other children who are adopted. The procedure for adding a spouse or children for that matter is that you visit the nearest NHIF office, and when we are talking of offices, we have run about 97 service points and any Huduma center. To add a spouse for the first time, you will need to produce, among other things, a copy of the national identity card for your spouse, a marriage certificate, or an affidavit from an advocate of the High Court of Kenya or the Chief Magistrate's Court. Remember, Ram, it is a requirement of the law from 2014 when the Marriage Act came into effect that it is mandatory for all people who are married to have a marriage certificate. So we implore Kenyans and viewers back at home, for those of you who've been blessed to enter into the union of marriage, to ensure that you have the legal instruments, which is a marriage certificate. And sometimes I tell people, a joke is made that if you stay with a wife or a husband and he does not take you to his home or to their place, and you do not have any legal instruments affirming that marriage, the person you are staying with can be identified as an identified female stranger. And the law is very clear. It is important for one to register their marriages.
So make sure that you don't, these come stay issues are the ones that are giving us problems here, yeah?
Indeed, it's a huge challenge to us because we have instances whereby contributors, principal contributors, come to their office, our office, at the point of hospitalization to declare spouses or dependents at the point of hospitalization. Remember, there is a period within which the card should mature.
Yes.
If you declare a spouse, there is a mandatory 28 days waiting period for the card to mature.
After the declaration?
Yes. So we are appealing to Kenyans to be forearmed is to be forewarned. It is important to declare your spouse at the earliest opportunity.
All right. So that's advice. And, you know, this is quite an informative discussion that we're having this morning. So make sure that you do all these, take notes. All right? These are things that will help you from home as a viewer, even as you talk about come we stay. Make sure that you are not declared as an
unidentified female stranger or male stranger.
But keep the tweets coming in, keep the SMS coming in if at all you have any questions. I would not like to be declared an unidentified male stranger. Let's talk about cancer, because we have the Breast Cancer Awareness Month happening this month in October. To what extent does NHIF cover cancer patients, both in public and civil servants?
Thank you, Ram. By there, I wanted to ask you when I came to the show,
yes,
whether you are an advocate for cancer, because the shirt you are donning is pink, and we are talking of the Pink Ribbon Month, which is the Breast Cancer Awareness Month that is marked between 1st of October to 31st October worldwide.
We are in the same spirit, my brother.
Thank you. I wish to affirm that NHIF indeed covers for breast cancer, and when we say covering, it covers comprehensively. But before I go to the details, I want to inform Kenyans that October is a very important month, because in the month of October, there are 3 major healthcare events that are marked worldwide. The first one being the Mental World Awareness Day, which is marked on 10th of October across the world. Secondly, we do have the Breast and Civic Cancer Awareness Month, which is marked between 1st of October and 30th of October every year. And finally, we also do have the Polio Awareness Day, which is marked on 24th of October. Having said that, what is the Breast Cancer Awareness Day? This is an international healthcare campaign that is organized by charities and organizations across the world. One, to raise awareness of breast cancer. Secondly, to raise funds for research, prevention, and diagnosis. And thirdly, to offer support to victims of breast cancer. Yes. At NHIF, we do have a comprehensive oncology package. In the year 2016, there was a baseline survey that was done, and it was noted with concern that a majority of Kenyans were paying out-of-pocket catastrophic expenditure for expenditure for cancer. And in realization that most Kenyans could not afford that, NHIF introduced the oncology package.
Because cancer so far is quite expensive for cancer patients in terms of getting the medical covers, making sure that they get the drugs and everything. It's very expensive for the common man.
Very true, Ram. The good news is that NHIF covers cancer treatment comprehensively under the oncology package.
And that's the key word, comprehensively.
Comprehensively. And under the oncology package, it is divided into three. One, we do have chemotherapy. And for chemo, for first-line chemo, NHIF is obliged to pay Kenya shillings 25,000 for every session of chemo. And we can pay up to a maximum of 6 sessions, which translates to 150,000 shillings.
And these sessions, do they have any limitation in terms of how frequent someone can be able to get the cover from NHIF?
They do. It depends on the stages of cancer, because sometimes patients may require more than the 6 sessions. They may require 8 or 10 sessions. But at NHIF, having known that sometimes not all Kenyans can afford, we've entered into an agreement with the providers like Kenyatta National Hospital and MTRH, which is the apex institution for healthcare in this country, to provide an avenue for catering for additional sessions in event they are required. To go back to the oncology package, for second line cancer chemo treatment, which is now complex cancer, NHIF is obliged to cater for 4 sessions, and for every session we cater for, we pay Kenya shillings 150,000. If you do a cumulative figure, it translates to 600,000 for second line. So for first line and second line, NHIF is obliged to pay a total sum of 750,000 shillings. But before we go there, we also cater for radiotherapy. And under radio, NHIF is obliged to cater for 20 sessions of fractions. And for each session, we are obliged to pay for 3,600 shillings, bringing a cumulative figure of 72,000. And of course, for purposes of staging, there is a CT scan. And CT scans are covered under the NHIF package under radiology. We are obliged to pay 8,000 shillings.
Now, okay, looking at the procedures, what are the pre-authorization procedures that are there?
Let me first share with the viewers back at home what is pre-authorization.
Yes.
Pre-authorization, in a layman's language, means prior approval of some medical procedure that need to be undertaken. It is a procedure. Pre-authorization is best practice that is in healthcare insurance financing. You realize that in this time and era, it is important for the healthcare financier to be able to know what procedures our members are seeking services for and what we should pay for. Some of the procedures that require prior approval or pre-authorization includes others, among others, the radiology package, that is MRI, CT scan, ultrasound, optical procedures, dental procedures, the much patronized, the surgical package. And when we're talking of the surgical package, we are talking of major surgery, minor and specialized organ transplants. We are talking of overseas treatment, whereby patients who ail from ailments that cannot be treated locally here travel abroad, and for that matter, the most common destination is India, to seek further treatment. We are talking of other procedures like maternity and other procedures like I mentioned dental and optical, inpatient treatment.
So you have to verify what kind of procedure the patient is going to go through before you give them the cover?
Apart from verification, as you've mentioned, we also seek to establish whether the requested procedure meets the need for medical necessity. And secondly, to establish that the providers are adhering to the capped prices that we signed up with them.
All right.
Yeah.
Quite interesting. And you talk about overseas treatment there. How do you cater for Kenyans who want to travel abroad to get treatment outside the country?
Thank you, Ram. I want to tell Kenyans that NHIF caters for overseas treatment. When we talk of overseas treatment, this is treatment that is not ordinarily available in the country, and as such, a patient has been referred abroad for further treatment. Overseas treatment is among the packages, the 13 packages that NHIF administers. And the requirement for one to qualify for overseas treatment is one, you must get a referral letter from the attending consultant. And I want to underline the word attending consultant, because it's only a consultant who can refer a member for overseas treatment. Secondly, the consultant must complete an overseas referral form. Thirdly, the member should proceed to the Director of Medical Services to obtain what is known as a letter of no objection from the Director of Medical Services, having looked at the documents you submitted and certifying that the condition cannot be treated locally. Fourthly, the member should obtain verification or certification from the Kenya Medical Practitioners and Dentists Board, affirming that the referring consultant is a member of regular and good standing, who has remitted and renewed his license up to date.
And with these procedures, is there any help? Are they quick? Are they fast? Are they efficient for the common man to access all these documentations for authorization by NHIF?
Indeed, they are very efficient. Once you submit the requisite document to NHIF offices at 6th floor, our mandate is to process the documents expeditiously. For members of the national scheme, popularly known as the Supa cover, NHIF is obliged to pay up to 500,000 shillings for overseas treatment. We also have other members whom we cover comprehensively, civil servants under the corporate schemes. We do cater for their treatment abroad comprehensively.
All right. And that process that you're talking about, how long does it take?
The time frame is not cast on stone, because remember, we also rely on other sister organizations, that is the Director of Medical Services, the Kenya Medical Practitioners and Dentists Board for clearance. On our part, once we receive the documents, we process expeditiously.
All right. And talking about the time limit also for pre-authorization, how long does it take after you've established all those details?
The ideal turnaround time for pre-authorization should be between 24 to 48 hours. But once in a while, especially over weekends and public holidays, sometimes they may go
extends.
Beyond. Yes.
Because of, people are at home. It's a holiday. And still on cancer, I have Njuguna from Kirinyaga.
Yes,
anauliza swali hapa. In order to be eligible for cancer cover with NHIF, how much does the unemployed youth or population have to contribute to be covered? And in most cases, only civil servants get the benefits of NHIF fully.
Karibu, what I want to demystify is that when it comes to the oncology cover or the super cover for that matter, we do not discriminate. All people are entitled to receive treatment. Remember,
whether they're civil servants or not.
Correct. It is a requirement of the constitution of this country that every Kenyan has a right to the highest attainable standard of health, including reproductive health.
Okay. And still on the issues to do with still on cancer, what are the in terms of payment, because we need to clarify that. Is there some sort of payment that someone needs to go through before they can be able to get that cover? The common man.
The scripture tells us that my people perish because of lack of sufficient knowledge. I want to use this opportunity to tell Kenyans that there are no additional payments for one to access the oncology package. With your 500 shillings, that is the super cover, you are entitled to access the oncology package. And it's not enough to access for treatment, diagnosis, and drug administration and dispensing. For the Breast Cancer Awareness Month, I want to tell our brothers and sisters back at home that we do cater comprehensively for breast cancer. And when we are talking of breast cancer, if we look at the diagnosis, we are talking of annual medical checkups whereby people can undergo physical examinations to see whether there are swellings in their breasts or lymph nodes. Secondly, they can go what is known as a mammograph or a breast x-ray to see whether there are swellings. They can also be diagnosed using a breast ultrasound to affirm whether there are swellings in the breast. And finally, they can undergo what is known as biopsy, whereby a special needle is inserted to the area where it is suspected there is a swelling for purposes of extractions of cells, which are tested for the presence of cancerous cells. And remember, we do have the radiology package, which covers for both the breast ultrasound and X-ray.
All right.
I am appealing to Kenyans to turn up in large numbers to healthcare providers which NHIF has negotiated with comprehensively. And for this month, we have a number of providers that are offering concessions for free breast cancer checkups. In Nairobi, they can go to Meditest, which is at Forest Road. We have an arrangement with HCG Cancer Care, which is previously known as MPSHA. We have an agreement with Kenyatta National Hospital, Nairobi West Hospital, Texas Cancer Center, and Nairobi Radiotherapy. My concern is that despite the fact that NHIF has negotiated with providers to offer checkups, very few people are turning up for those checkups. And indeed, it's a matter of concern. Remember, the cornerstone for fighting breast cancer, which has no cure, is early diagnosis and treatment.
All right.
We can be able to save lives if people are diagnosed early.
And it is quite sad that sometimes people fail to turn up for these, activities and they are free.
Yes.
And it is encouragable that you make sure that you turn up for them. Let's talk about outpatient facilities. If someone wants to change their outpatient facilities, how can they do that? And when is the appropriate time?
NHIF administers outpatient package, and under the outpatient package, members of NHIF are required quarterly to select a facility of choice based on convenience and proximity, whereby members can be able to access services. For choice of facilities, members can go to any of the NHIF offices, and that matter we are talking of the 93 access points and Huduma Center, complete an NHIF choice of facility form, which is known as NHIF 38, selecting convenient facilities for both the principal member, the declared spouse, and dependent. And it is not mandatory for the entire family to select one facility. Based on where they are convenient, you can select a facility, for example, for your wife who is back in rural Kenya, select a facility that is near him. For your child who's in school in Mombasa, select a facility that is convenient to them.
So it doesn't depend on which facility it is?
Yes, it doesn't depend. There is a list that is available at the NHIF website, whereby members can go to the website, and our website address is www.nhif.or.ke, and look at the facilities that are available and convenient to them.
All right. Osoro, does NHIF cover rehabilitation?
We do have a drug and substance abuse package under which members can be able to access services. We do pay for the drug and substance rehabilitation package. We do pay Kenya shillings 60,000 for admission to a rehab for a period of 90 days.
Right.
Remember, it takes long for one to be rehabilitated. Yeah.
As we bring this discussion to a close because of the interest of time, let's talk about that card. The NHIF,
smart card.
The smart card, the NHIF card. Can someone use their card in any hospital?
Yes, you can patronize any of the 8,600 facilities for purposes of treatment.
Thank you very much. That is Gilbert Osoro, the manager public education in the National Hospital Insurance Fund. Keep this conversation going on our social media platforms. At the top of your screen, our SMS line 20154, and at the bottom of your screen, our social media platforms on Twitter and Facebook. That is on Matters NHIF. It's all about NHIF Afya Yetu, Bima Yetu. That has been Health Tuesday. Always a pleasure having you. We're taking a short break. We'll be back in a bit. Good morning, Kenya still continues. Keep it KBC.